My name is Emily Davenport, and I'm an assistant director with the National Institute for Fitness and Sport, otherwise known as NIFS, and we provide fitness management services to active aging communities across the country. And I support our clients and staff in developing programs to engage residents in fitness and wellness offerings. And today I have Kara Long. She is the Director of Lifestyle and Health for one of our retirement community clients here in the Indianapolis area. And she's going to speak with you about her Educational Wellness Series program that folds in that education element to residents. So Kara, go right ahead.
All right. Today I'm going to talk about, as Emily said, the Educational Wellness Series program. Okay, nothing's advancing.
Educational Wellness Series program. My name is Emily Davenport, and I'm an assistant director with the National Institute for Fitness and Sport, also known as NIFS, and we provide fitness management services to active aging communities across the country. And I personally work to support our clients and staff in developing unique programs to engage residents in different fitness and wellness offerings. And our feature today is with Kara Long. She is our Director of Lifestyle and Health at a retirement community here in the Indianapolis area. And she's going to speak with you about our Educational Wellness Series program that she developed for her community. Kara?
It skipped.
Wellness Series program. My name is Emily Davenport, and I'm an assistant director with the National Institute for Fitness and Sport, also known as NIFS, and we provide fitness management services to active aging communities across the country, and I support our clients and staff in developing unique programs to engage residents in different fitness and wellness offerings. And here to speak with us today is Kara Long. She is the Director of Lifestyle and Health at one of our communities here in the Indianapolis area, and she's going to speak with you about the Educational Wellness Series program that she developed at her community. So, Kara?
Okay. In this webinar, I'm going to go over what the Wellness Series is, different topics that we've used with this Educational Wellness Series, some different examples of the wellness agendas that we've developed over time, speaker options. I have an example video, attendance history, and the costs and benefits to residents and the community as well. So first of all, the Educational Wellness Series was a program that I developed to give residents information on health and wellness related topics. So outside of the programs that they get to come to and the coming to the fitness center and working out, we wanted to make sure that they were educated on the areas of wellness as well. In that sense, we were hoping that they would feel more of an obligation to exercise and to come to our events and programs dealing with wellness. We want to start with a general topic area. So what we did is we chose topics that our community was most interested in. So all those questions that you get from your residents on a regular basis are things that they need to know more about. So that's kind of where we started to get our topic areas. Then you want to break it down. We've done actually three different now types of Educational Wellness Series. We've broken it down from 2 weeks, 4 weeks, and 6-week sessions. So depending on your community and how much programming you need to offer, you can break that down. We do ours now monthly, so every Wednesday at 2 o'clock we have a wellness series. So a different speaker that comes and talks. You can break it down where it's maybe 6 different week sessions, and we've also done it where it's twice a month. So just depending on the need of your community and how much time you have for the extra programming. We also have done it where, and I'll show you in a little bit some examples of speakers, where It's the same speaker, so they do the whole wellness series. For example, maybe a pharmacist comes and does a whole wellness series on pharmacy and medications, or we've had different speakers each time on the same general topic. The sessions, they're not always listening, so we do encourage our speakers to do some interactive type of the class. So maybe it is a Tai Chi instructor that's giving the overall, she's going to give an overall informative presentation on what Tai Chi is and what the benefits are. But then at the end, the last 15 minutes, they do a Tai Chi class. And then possibly we fold that into our programming and we offer a Tai Chi class for the next month or something like that. So sometimes it can tie into your programming as well, which is nice. So I'm now going to go over a few examples of some of the wellness series topics that we've chosen in the past. You can see there we've done relaxation, healthy bones and joints, balance, special populations and exercise, total body strength, weight gain, weight loss and exercise, weight gain, weight loss, and nutrition. So within each of these general course names, we developed a program for each one. So we found a speaker or speakers, plural, to come and talk on those general topics. Some other topics we've had is nature opportunities, heart health, meditation, relaxation, nutrition, active senior sports, specialists, pharmacy, joint replacements and injuries, brain health, specialists in self-care, balance, fall prevention and mystery, wellness, goal setting, exercise, nutrition, and overall wellness, and walking and posture. And then a few more are personal development and a fresh start, pharmacy world, mind-body connection, powerhouses of the body, respiratory health, arthritis, wellness around the world, neighborhood watch or safety and first aid, aging with vitality, emotional health, chronic medical conditions, and beat the stress. So I have a few examples of the agenda so you can kind of see once we get that general topic. So for example, this one is joint replacements and injuries. So we give a general description on what they're going to be in that entire wellness series with the different speakers, what they're going to learn. And then we break it down week by week with the different speakers. So you can see here our first speaker was actually a doctor and that did total joint replacements for hips and knees. And he came and talked about the surgical aspect of joint replacements. Then we had a physical therapist come and they talked about ways to prevent joint replacements, and they also talked about what to do after you've had a joint replacement. And then the last session, we had a massage therapist come, and they covered general aches and pains, so ways that massage therapy can help you with your joint pain. So as you can see, we have 3 separate speakers that talked on they talked about different areas of the same general topic. And as you can see here, we pulled from different specialists. So the community, we used some doctors in the community, we use our on-site physical therapist, and we use our on-site massage therapist. So we used community speakers as well as internal speakers. This is just another example. This was a wellness series on brain health. So we did a general description there. And then you see here that we had a wide variety of speakers as well. We did a laughter yoga instructor. We did a dementia specialist, and we also had our internal dementia programming director here to talk, which was really nice when you throw in an internal community member, our staff member, because then the residents have someone to go to right after if they really feel like they have a concern, which is nice. And then we also talked about our internal brain fitness game that we have available at our community. So it's nice to be able to kind of throw in things that you are already offering as services, because it's just another way of promoting some of the things that you already have. So speakers, I've talked a little bit about this, but I'm just going to give you a little bit more information on areas that you can kind of pull from to get your speakers. Department directors, so those are those internal clients. So you could have, we've used the dementia director, your nursing director, security. Our security department came and talked about safety first. It's really good around maybe the holidays that you have a wellness program on safety first. So we had them talk about what to do when you're out shopping, and what to do if you get phone calls asking for money, and different things like that that happen a lot of times around the holiday season. If you have a dietitian or chefs on staff, we've had them come and do cooking demonstrations, different areas on how to eat healthy off the menu, those type of things. We've also used our internal therapy department, and we use them quite a bit, and they can offer a lot of great wellness talks for you. Physicians, so different physicians in the community, a lot of them are more than willing, as long as you give them enough time, to come in and speak on the different topics. We've also used residents to speak to their fellow residents and neighbors and friends about how they stay involved in the different areas of wellness, and also yourself. I myself have given a lot of talks just on different topics, depending on what your specialty is. There might be an area that you can talk about that you feel comfortable with. Outside people, I've talked about the doctors and that kind of thing from the community. They're usually more than willing to do it. Chiropractors, professionals from local universities, massage therapists, dentists, wellness instructors, all kinds of reasonings there. Some of the benefits, I think, it for your inside speakers, so your internal ones that come from your department directors, dietitians, therapists, those kind of things, are referrals. It also is, for the inside, is marketing, or outside, I'm sorry. If from the outside, it is marketing. So if you have doctors coming in and speaking, they get to see your community and the great programming that you're doing, and that can be great for them for referrals for their patients. References, and also just visibility. So all right, so next is attendance history. Just so that you can kind of get an idea, you're going to notice that some topics were more popular than others, and this is great information to know. So when you're doing your future programming, we know that the relaxation in 2011 was a great success. Maybe we need to offer in 2012 another relaxation session, just to kind of refresh their memory or put a different spin on it. Again, the healthy bones and joints was really popular too. But as you can see, the special populations and exercise really wasn't. So we need to look back at that to see why that must not have been a topic of interest at that time. So that's just good information for your community. Again, in 2012, you can see that balance and fall prevention, and I would highly recommend that this is on, if you decide to do this program, that balance and fall prevention is one of the programs that you offer, because it is very popular and it's very important. Also, the brain health is always every year a great success. So those are two great programs, as you can see. And then in 2013, you can tell that the mind-body connection has really kind of skyrocketed there. So what we kind of pulled from that and really helped us is we started offering more mind-body connection type classes, Tai Chi, yoga, Qigong, those type of things, and those have really taken off here. So it also can help you with planning for the future. Those are attendance history averages from 2011, 2012, and 2013. So that just kind of helps us see if we need to revamp our program, what we need to do, those type of things to make sure that it's still working for us. Cost and benefit to the residents. So to the residents, it's no cost. We bring the speakers in for the residents to come, and they can kind of come in. They don't have to tell us they're coming. They don't have to sign up or anything. We just have chairs set up, and they can come into the lecture. They're going to gain education. They're going to build references for their personal self. So if they are looking for I don't know, they're looking for a way to relax, they can come to our relaxation session and maybe learn something new about breathing or massage therapy or something like that. So it kind of helps build their references. And then it's also a reminder of those in-house services. So if you use some of your in-house staff, that's really a way for the residents to get that extra reminder. I know when they move into the different communities, there's a lot of information given to them all at once, and not everything can be absorbed. So this is just another way of promoting some of those in-house services. So cost and benefit to the community. It's a very low-cost program. Like I put on here, I have spent less than $1,000 in programming for it for the last 3 years. And I've had approximately 85 speakers. So I'm pulling from those internal and those community members from the outside that are more than willing to come, and there's no charge when they do come, because it's also beneficial for them as well. So it really, I haven't paid very many speakers to come. A lot of them are happy to speak and to help benefit the residents with their overall wellness. Benefits to the community is staff visibility. So when you're using those internal speakers, they're getting out there, because a lot of times the director of nursing is not seen a lot by the independent living residents if they're not needing to use the nurse services. So that's just a way of them getting to know some of the staff that they don't see every day. Referrals. This really has been a big referral program for our therapy department and our clinic, because a lot of the independent living residents, like I said, if they haven't had to use these services, they don't really think about them. So we really get to reiterate that we have the therapy department, we have a clinic, and we have that healthcare center. The healthcare center is a little bit more obvious than the therapy in the clinic, but they still can be used for referrals. Possible improvements and suggestions. One example of that was whenever we did have our dietitian and chef come and do a whole nutrition and how to eat healthy at our community type program, we actually we developed what we call the Happy Heart menu out of the feedback from the residents, and they're still using that to this day. So it really helped overall nutrition with our food and beverage department. So that was a nice aspect to that. And then resident satisfaction is also just a kind of an added bonus to that. And now that's all for my presentation today. I'll let Emily kind of close out for us.
All right. Well, thank you so much, Kara, and thank you for participating in our webinar today. If you are interested in more information about our best practice series, additional resources for your community wellness program, you are welcome to visit our website listed here, or you're welcome to call us directly. Once again, thank you for joining us today. Goodbye.